Hi, I'm Dr. Tanya here with Tuesday's Tips. And today we are once again talking about COVID-19 and how to safely get our kids back to school. And this is because new information and strategies are coming out every day. And this is an issue that schools and districts and communities across the country and across the world are working very hard on, because we want kids to be back in school, to have as much of a new normal school day as possible, to still be able to enjoy engaging with others and learning. And this is really going to take a team approach to get it right. Now, fortunately, we have many countries around the world who have already been in this a few months ahead of us. Their kids are already back in school, and they are sharing with us their data and their strategies and their tips for what's working and what isn't. And this is what we are going to be able to continue to base our strategies on here in the United States. If you haven't already subscribed to my channel, please do so. I come to you every Tuesday with tips for keeping your family healthy and safe. So you may have seen my article in CNN 3 weeks ago on the 3 pillars for safe school reopening. And this is to decrease the virus entering the campus, to decrease transmission among students and staff, and to identify cases, contact trace, and notify the individuals that we need to be able to test them to help decrease the spread throughout our community. Now, what's interesting is I've been hearing from not only schools and districts and families across the country, but also businesses, companies, biotech companies, and even retail stores that are calling me saying, hey, Dr. Tanya, we are using your 3 pillars for safe opening, and we are reapplying it to our business, and can you take a look at our strategies and see if this is something that you feel is safe and will be effective? And because of this, I have been able to gather lots of new ideas and tips, and also with the creativity of many school teachers and administrators around the country, our plans are continually changing as we are looking for ways to make this the best and safest environment for our kids when they get back to school. Now, it's important to know that every situation is unique and will be different based on the area of the country that you live in and the size of your school and the size of your community, and also the amount of volunteer and parent involvement and community physician involvement that you have helping your school. This really does take a village. So if you haven't already volunteered to help your school and district figure this out, please do. They need your help. Okay, so the first thing is, how do you decrease the virus from entering the campus, the camp, or the business, or the building? So for schools, this is going to involve scattered drop-off time. So this could be by letter of the alphabet. It could be by classroom, by grade, by areas around the campus that you're in. You might have different times that cars come up or that buses pull up at school. There are some larger districts looking at only having half the kids on campus every day, or even a third, based on the size of their classrooms and what they can accommodate. There are smaller schools with large outdoor space that are able to get every child on campus every day, distanced. And so this is something that your community will have to decide on. The other thing that is going to be very important is health questionnaires and screenings. And how are you going to ask your families every morning, has your child or anyone in your family been in contact with anyone who tested positive for COVID-19 within the last week? Has your child or anyone in your family or anyone they've been in contact with had any of the following symptoms? Temperature of 100 degrees or higher, cough, runny nose, fever, chills, aches and pains, diarrhea, and the list could go on, but we're going to try to tailor it based on every community, so it's easy for parents to pull up in the morning and say, no, no, and the child can get out, get their temperature checked, and then quickly go through the door to their open classroom. Now, the reason I'm recommending 100 degrees Fahrenheit or 38 degrees Celsius is because if a child has 3 digits, 100 degrees in the morning, chances are their temperature is going to get higher throughout the day. And I think in most cases, this is a child that will need to be evaluated. It's true that as a medical provider, we do use 100.4 or higher when saying, hey, your child does have a fever. But right now, we want to try to screen out anyone that is potentially contagious. And so we're going to be a little stricter at the beginning, especially at the beginning of the year. Number 2 is to decrease transmission amongst students and staff. And let's not forget that many of our teachers and administrators and school nurses maybe older, may have underlying health conditions, and maybe in the vulnerable population of our community. And so it's just as important, maybe even more important, to protect them, since they are going to be the ones moving from class to class and potentially in contact with more students each day. So what are some strategies schools are going to use to help decrease transmission across the campus? And some are going to be putting the kids into smaller classes. And this especially works well in elementary school, where you can have a class of 10 or 15 kids who are going to sit in their desks that are distanced out, who will probably be wearing masks and having frequent hand washing and bathroom breaks and disinfecting everything, especially anything commonly touched. And we're going to try to decrease having things that are commonly touched whenever possible. So perhaps activities that classes would do, let's say normally 3 second grade classes might go to science that day and work with the same types of circuits and other different activities. What we might do is rotate and have the teacher bring it to the classroom for one class, then clean it off, and then the next day that will go to the following classroom. So we might have different classes learning different things every day. We want to try to have your child mix with as fewer children in classes as possible each day, and the reason for this is contact tracing. So some schools may have assigned seats, that way we know who your child's been exposed to. Some classes are going to use masks, face shields, or plexiglass as well to help decrease the spread of the virus through the classroom. We're also looking at airflow, air conditioning systems, and how can we get kids outdoors whenever possible. The more airflow, the better, and anything outdoors definitely decreases the risk of transmission. So if you have a school where the doors and windows open outside, you can simply leave them open, and that will help. When you have indoor buildings, then we have to be creative and come up with other solutions, such as fans. For middle school and high school, we have administrators around the country working hard to figure out how can we create a new schedule where kids will still move around a little bit from class to class, because let's not forget, one child might be interested and want to take Spanish and AP Computer Science, while another one might prefer to take Chinese and instead want to do a music class. So we might have different tracks throughout the day. We might have 3 classes a day with longer class times. You know, every school is coming up with their own new ideas, and it's so exciting and interesting when I review all of them, because I just can't believe, and I know I keep saying this, how creative all of our teachers and administrators are. And they are always looking for the best ways to engage your kids and to get them excited about learning, since that's what school's really all about. Now, what about other activities such as sports and music and recess? We do expect all of these activities to still happen, but they may be slightly different in a more safe way. So for instance, swimming might be one child per lane swimming the opposite direction. Soccer may have some new rules where you're still kicking the ball and running around the field, but you're trying not to be as contact as past soccer seasons. And again, this isn't forever, right? We don't know how long this will go on for, but we're hoping that if we do everything right, we will see fewer and fewer cases every day in this country. And hopefully we will eventually be able to get more back to normal, especially if we come up with better treatment options, and also in the future, potentially even a safe and effective vaccine. So the next thing, and potentially the most important thing, is how do you identify cases when they happen? And at school every day, we have teachers say, you don't look so well, why don't you go to the nurse office? And the nurse checks out a child. And so if we do feel that a child may be potentially contagious or even is sick, even if they have the regular common cold, we are going to be a little more strict this year at school, and we are going to have them evaluated as soon as possible by their pediatrician or their healthcare provider. We are going to require more COVID-19 testing because we want to make sure that kids have negative tests before they come back to school. And the good thing is that in many places around our country, especially here in California, we do now have testing available. And let's not forget that by the time school starts in 2 months, we will even have more rapid testing and other ways that we can test kids, such as something called pooled testing, where we can probably go in and test every child in a classroom and then find out in an hour, are they all negative? Or is one child positive, and then we need to go back and really look at each different child's swab and figure out who is the child who is positive and how can we separate them. Now, there are some privacy concerns here, and so parents are going to have to realize that, if we find out that a child is positive, we're going to have to figure out a way to notify those families that we're concerned may have been in contact with the child, so that way we can help get them tested as soon as possible. And these are all measures that we are going to take to keep our kids safe when they go back to school this year. Now, questions parents have been asking me is, how is my child going to make new friends if they have an assigned seat, if they're wearing a mask and nobody can see their expression? And I just want to reassure you that our kids are very resilient. They will make friends, they will learn, they will adjust fairly quickly and easily to this new normal, and they will still find friends that they like to hang out with at recess. Even though they might be a little distance away, they will still find friends that they want to talk with after school and on the weekends, whether that's virtually or a physically or healthy distanced play date at the park or in somebody's backyard. This is an ever-evolving situation. So I think we all need to talk to our kids about it and just explain to them, why these things are important, why it's important that we start wearing masks, why it's important that when we see our friends, we don't run up and hug them, but we stay a safe distance away. And that this isn't forever, but if we all work together as a community, as a school, as a country, then we can hopefully get our children back to a more normal school day. I don't know that it will ever be back to the way it was last year, but actually some of the things that we're learning from this pandemic are going to be very helpful in the future. Because kids will be washing their hands 5 times a day, I am confident that we are actually going to see fewer illnesses now every winter spreading through schools. Because school districts are now going to be disinfecting everything, every day, and frequently, we are going to see fewer illnesses being transmitted from classroom to classroom, from day to day. So I think there are many things that we are all learning that we will take with us in the future to continue to have a safe and healthy and engaging and fun school environment for all of our children. But in the meantime, what I ask for all of you parents out there is to please work with your schools, work with your districts, and try to come up with a healthy balance so that way your kids are getting everything that they need while remaining safe. And let's not forget that there will be families who are unable to send their kids to school, either because their children have underlying medical issues, or there will be families whose kids will have to stay home periodically because they are sick or they were exposed to someone who was sick and they need to be home for 7 days. So the other challenge that our schools are now facing is that they're going to have this high flex model of teaching where they will all have to have both in-person and online instruction every day for the entire school year. And again, this is going to take patience and cooperation from our entire community. But I do believe that it can be done, and it needs to be done for our children and for our children's future. Thank you. See you next week. This is Dr. Tanya. Please subscribe.